and thank you for joining us. So I wanted to bring us back together today because the pandemic in Philadelphia has taken a turn that none of us wanted to see. Cities and states across the United States, countries around the world have seen their COVID case counts rise rapidly due to the Delta variant. We believe that the Delta variant is now the dominant strain of COVID in Philadelphia, and that's what's causing our case counts to rise as they have been. I want to be very careful about how I describe the situation that we're in now. The number of cases we're seeing right now is about what we saw last summer and is much lower than when things were at their worst. What concerns me isn't just the number of people who are testing positive or the number of people in the hospital. I'm concerned about how quickly those numbers have risen. They doubled between July 12th and July 19th, and then they doubled again between July 19th and August 1st. We announced the strong recommendation for everyone to mask indoors regardless of vaccination status based on that initial doubling of cases in a week, coupled with the situation around the country and a slight rise in hospitalizations among children. The rise in cases slowed very slightly, but not nearly enough. We need to come together as a city once again to fight back against this new surge. But this time we have better weapons. We understand the virus better, how it spreads, how we can protect each other and ourselves. And we have plenty of safe, effective, free vaccines available all over our city to protect us. I'm going to be completely open here. Being fully vaccinated doesn't mean you can't get COVID. You still can, but your chances of getting COVID are much lower, only about 1/8 the chance of someone who is unvaccinated. And being fully vaccinated means you are much, much less likely, but 25 times less likely to get seriously sick or end up in the hospital if you do get COVID. Because of that real protection and the fact that so many people have been vaccinated now, almost everyone in the hospital with COVID these days is unvaccinated. But vaccines aren't the only protection you need now that Delta is spreading in our city. To reduce your chances of getting COVID even more, wear a mask when you're inside in public spaces, whether or not you are vaccinated. We know for a fact that wearing a mask when you're around other people in public, especially indoors, reduces your risk. Avoid crowded indoor public places. The more people in any one space indoors, the more likely that someone in that space has COVID and can spread it to others. Get tested if you start to feel sick and quarantine away from everyone else until you get your results to help protect those around you. And if you test positive, you need to isolate away from everyone for 10 days after you start to feel symptoms. That's going to be what helps protect those around you. If we do all of these things, we can stop this rise in cases before it gets worse. Vaccines, mask use, avoiding crowds, testing and isolation and quarantine have solid science behind them. We are all tired of this pandemic, and the social isolation it's brought is also a real risk to people. So keep in mind the ways of socializing that are safer. Getting together outside, limiting your socializing to those who are vaccinated. When you do get together with people who aren't vaccinated, limit the numbers of people to lower your risk. Hold gatherings that include children too young to be vaccinated outdoors or with masks on. And mask if you attend any kind of a public indoor event. We know that it's easier to buy into something that's hard if you know why you're doing it, which is why starting tomorrow, I've directed my staff to begin updating the testing and vaccine dashboards on the phila.gov/COVID website every weekday, and to start posting the daily numbers of cases and vaccine administrations on our Twitter account every weekday. You should know how things are going, and you should have someone there to help you interpret what's going on. That's why we're restarting these weekly press conferences. I'm sorry we don't have the days and times set just yet, but it's important to be here each week so we can all get through this together. Thank you so much for all the work each of you do to help get the word out. You are very, very powerful messengers that we need right now.